And so for people that are watching that either struggle with depression or know someone with depression, like you're kind of an expert in depression, and a lot of the work you do is on the depression study at Imperial. I mean, what are some things that maybe people don't understand about depression? Or I guess the typical thing, if you're in America, is you go to your doctor and you say you're depressed and they write you a prescription.
Yeah.
So I don't know, what should we know about it?
So I think, well, firstly, there's the medical model understanding of depression, which is that it's a particular disorder and that you can be diagnosed by a doctor, GP, or a psychiatrist. And if you have certain of the symptoms, then you can, you fulfill the criteria for that diagnosis. That's the medical model. That's one way of understanding it. I think that in that model, things that have happened to you in your life, traumatic experiences in your childhood, don't come into it. So the way I understand depression is that everybody that comes to see us, or everybody that contacts us because they want to be part of the study, when they talk about their life, when they feel safe enough to talk about their life, there are things that have happened to them in their childhood that have had lasting impacts on them. I mean, for most of us, for all of us really. But for some people, those events that have happened, those things that have happened have, for whatever reason, we're all wired differently. There's so many different factors at play in how something unfolds. Epigenetics, all of these different factors, but that for some people, those events seem to prevent them from moving forward in their life, and they seem to lead to the development of so if you think about your kind of mental chatter, your ego structure, your default mode network, it can also be called. It's the self-preservation system that we develop to keep us in line, keep us safe. So when things happen to us when we're young, things that feel scary, or just things that make us feel that we're not good enough, often we will develop a self-protection system that is really trying to course correct, trying to make us better, trying to make us more likable, or less likely to be abandoned, or less likely to be bullied. It's a huge factor. So we will develop this internal system which says, don't do this, you've done that wrong, don't do that. And it's this kind of critical inner voice that's trying to keep us in line. So what we develop as a safety mechanism to try and make us better and more safe and be able to be accepted by our peers and our families becomes a harsh prison, because that internal safety mechanism becomes the ruminating voice of never-ending critical, punitive directions. And that is what depression is for many people. It's being they can be in any setting, and they might look like they're okay because they've learned how to smile and be nice and laugh, and but inside what's going on is that the protective system is just attacking them constantly.
Wow. Until
they feel so hopeless and desperate because they feel like they're worth nothing, because they're constantly being attacked by that inner voice.